At American Back Centers, you've got nothing to lose but the pain.
The following program, BackTalk, is sponsored by American Back Center.
At American Back Centers, you've got nothing to lose but the pain.
Welcome to BackTalk with Dr. Peter Pedduzi, located at 103 Bradford Road, Building 2, Suite 100 in Wexford. Now, with BackTalk, here is Dr. Peter Pedduzi.
Good morning, everyone. This is Dr. Peter Pedduzi with another episode of BackTalk. So I'd like to start off each and every week. I'd like to say hello to all our loyal listeners. Of course, thank you for listening. And a special hello to anyone who is new to this radio show. This, again, is BackTalk with myself, Dr. Peter Pedduzi. We're on every Wednesday morning on KHB 620 AM from 9 to 10 in the morning. Of course, if you are new to the show, typically in the first half hour of the show, we talk about the very unique and wide variety of treatment options we offer all under one roof right here at the American Back Centers. In the second half hour, we typically pick out a nutrition or fitness-related topic. Last week we did have to run a tape, so I did promise you we're going to be talking about, 2 weeks ago, low back pain in running athletes. So we definitely will be touching on that today. This, again, is from dynamicchiropractic.com. If you listened to the show the last couple weeks, prior to last week when we ran a tape, we talked about education and gluten sensitivity, some of the issues with celiac and gluten-free diets, and some reasons why blood tests and biopsies are not always the way to go about testing for this. And we talked about that, how there's this, quote, non-gluten diagnosis, that people that actually are sensitive to these things, but they're not showing up on blood work as well as biopsies, which was a standard for diagnosing gluten sensitivity at one point. Also, we talked about a few weeks ago nutrition for menopause, some of the frontline therapies, natural therapies, alternatives for women suffering from menopause symptoms. So this week we're definitely going to be touching on low back pain in running athletes. If you know a runner, you're a runner, definitely stay tuned for the second half hour of the show. We're going to be touching on that. Some of the things we do with our runners that come in the office, how we help them, some simple treatment options, some of the typical muscle tightness, restricted areas that is very common in runners. We'll go over that as well. Some of the common injuries that are occurring in your typical runner. So we'll definitely touch on that. And some of the natural ways we help runners get out of pain, specifically low back pain. So definitely stay tuned for that in the second half hour of the show today. If you are new to the show, of course, at the American Back Centers, we are not your typical chiropractic office. Since 1994, the American Back Centers has specialized in the treatment of very difficult cases, including herniated disc, bulging disc, failed back and neck surgery, sciatica, stenosis, degenerative disc disease. We have truly seen some of the worst, hate to use this term, but train wrecks at our office. We've seen some of the worst cases, multiple failed back surgeries, patients coming in wheelchairs, crutches, canes, in many cases walking out without those assistive devices because now their condition has structurally changed, not just putting a Band-Aid on the problem that we see with pain medication, epidural injections, symptomatic, even in most cases, physical therapy, which we do at our office. We do therapy and rehab, but if you're not actually addressing the compression on the disc, leading to your degenerative disc disease, your herniated disc, bulging disc, leading to your sciatica, your stenosis, spinal stenosis, then you're not really treating the problem. You're just attempting to strengthen the muscles that support the area, which is very important. But in some cases, when the disc is hot, as I talk about on the show all the time, when it's inflamed, when it's irritated, when the nerve or the disc is inflamed or irritated, you can actually just make things worse by putting excessive motion in the area. And this is coming from a chiropractor, a chiropractic adjustment in some cases, and can irritate a hot disc or a hot nerve, and that's why we get a lot of referrals from other chiros, because they've treated the patient, they've helped the patient for years, now they've developed the problem, whether it's a more serious herniation or extrusion of a disc, foot drop, whatever it may be, failed back surgery, and the disc is not responding to the adjustment, and in some cases may be irritated by the adjustment and or the therapy. We see a lot of people come to us from physical therapy. They try to strengthen the supporting structure, the muscles and such, but they're not really treating the disc. With VaxD, we actually treat the disc. So to make a long story short, so this practice was started over 45 years ago by Dr. Dennis Miskovich. We've been in this local Wexford, Cranberry area all that time. In 94, he saw the groundbreaking research that was done and published in the Journal of Neurosurgery by two neurosurgeons, Drs. Ramos and Martin. And they published this research. They did the research on real live subjects receiving VAX-D therapy. And that's important to know because there's a lot of people that have these glorified disc treatments that claim that this research applies to their devices, and this research was not even done on their devices, number one, and this research was done many, many years before their so-called traction, or I should say so-called decompression devices that are just glorified traction were even thought of. So how can you state that this research applies, but they still do, unfortunately? They still use the term decompression from anything from an inversion table, traction devices, even pump-up inflatable devices I see that go around the neck. They call that decompression as well. So you have to take everything with a grain of salt when you hear the term decompression, because the term is used so loosely. And true, if you know what true decompression is, and VAX-D, vertebral axial decompression, true decompression is when you actually create negative pressure. You prove it through medical literature. And this was proven and published in a Journal of Neurosurgery by two neurosurgeons again, Ramos and Martin, published in a peer-reviewed medical journal, the Journal of Neurosurgery, showing that each and every time you undergo only VAX-D therapy, no other device has been proven to replicate this research on real live subjects, real people. They put pressure sensors inside the inner disc, inside the patient undergoing the therapy, and negative pressures were reduced to a negative 160 to a negative 200 millimeters of mercury each and every time they underwent the therapy. So negative pressures were produced, and that negative pressure is forming a vacuum. That vacuum is what's pulling the disc material, the fluid, the nutrients, the oxygen back into the desiccated, compressed disc, the disc that's bulging, herniated, extruded, causing your sciatica, causing your stenosis, causing your pain, your numbness, your tingling. That pulls that disc, that vacuum, that negative pressure pulls the disc, retracts it back into its intended position, off the nerve, out of that spinal canal. So if you have spinal stenosis or narrowing of the canal, pushing on nerves. Compression of the spine, we talk about how the vertebrae start to lose height. They start to compress together. The disc, I should say, loses height, and the vertebrae, the bones, actually come closer together. They form those stalactites and stalagmites, I call them, in the cave. They're not actually stalagmites. They're actually bone spurs that are forming on the top end plate of the vertebrae on the top of the disc and the vertebrae below the disc. They start to creep together and eventually want to fuse. With VAX-D, we're able to open that space up, halt that progression of those bone spurs, that arthritis, that spondylosis, which is a technical term, leading to compression, degeneration, starving of the disc. Because that's why when you look at the MRI, the disc is losing fluid. It's getting grayer, it's getting blacker and keller on the MRI as opposed to the natural aging process that occurs throughout life. So the space is closing up. The bone spurs are starting to approach each other. The disc is starting to smash, kind of like sitting on a jelly donut. The jelly, the nucleus, the fluid of the disc is oozing out, bulging, herniation of the disc material onto nerves, into your spinal canal, leading to sciatica, numbness, tingling, spinal stenosis, narrowing of the canal because the disc is pushed out into that canal. So only VAX-D has been proven to retract that disc material off the nerve, out of the canal, open up the disc space, allowing fluid and nutrients, oxygen and fluid back into that starved, desiccated disc, but also, even more importantly, halt that progression of that possible fusion of the spine. Even surgery cannot do that because surgery does not address that. It just snips off a piece of the disc, but the compression is still occurring. And it's a fact. You can see it. And then they got to go in there and do a fusion surgery in some cases, putting the rods and screws in there, taking care of the compression, but then now we know the areas above and below have to compensate for that fixed fused segment that used to move, and now it can't move because of the fusion procedure. So we've helped literally thousands of patients over the years since 1994 avoid back surgery. People have already had failed back surgery have come to us, and we have helped them. Patients with sciatica, stenosis, foot drop, all of these difficult train wreck cases I mentioned. Again, we would rather see you before you go through that whole list of things I just mentioned: pain medication, prescription, over-the-counter, physical therapy, pain clinics where you go in and get pain shots, epidurals. Those type of things are okay, but if they're not working for you, the longer you wait, the condition will progress and get worse. Then you end up going for a surgical consult. They tell you, in many cases, come back and see me when the pain is unbearable. Because they know that surgery is not the best approach unless you have to do it. Because they know you're going to go back to the pain clinic, get more pain shots, maybe get a little bit more physical therapy. And they know the first time around, if that didn't help, chances are, and you can just see the research, the stats, it's not going to help you the second time around. And then they know you're going to be back for surgery. They're going to do the surgery. And then in most cases, you're going to have to go back for another surgery after that surgery, again, does not address the compression, and then eventually a fusion surgery where they put the rods and screws in there. So it's a money-making procedure. I'm not saying all surgeons are like this, but definitely some of the hospitals are, because it's an easy way to make a big buck, because these procedures cost a tremendous amount of money, and they keep doing them. And we talk about this. We have that paper that we sent out to you. We've been sending out for years called Knife in the Back. It shows how lumbar fusion surgery continues to be done, even though it's not very successful and has a high rate of complication. I have patients come in each and every day with surgery, and just not even back surgery, not even spinal surgery, patients having knee replacement surgery, hip replacement surgery, and those procedures tend to be a lot more successful than spinal surgery, and that's quite obvious. But then you still run the risk. Just had a guy the other day who had a knee put in. 4 months later, now he has a knee infection. They finally did the blood work after they did an X-ray to make sure the knee was stable, the prosthetic knee was stable, and now he has an infection, a major infection of his knee. And guess what? They got to take out the prosthetic, clean it up, put a temporary in, let it heal, and then put another one in now because the infection. So these infections, these blood clots can occur as well with any surgical procedure. But definitely with spinal surgery, the success rate, and we talk about it, and we'll talk about it more today, is not very good with spinal surgery. So we're able to help people all over the tri-state area, and in some cases even further. We've had professional athletes. We've had people from all over the country. As I mentioned on the show, 2 years ago, we had Forrest Whitaker, a professional actor. He was doing a movie. He started VaxD down in Georgia, and he wanted to finish it here as he was filming a movie. He did his last 16 to 20 treatments here and recovered quite well, even though he was doing a physically demanding boxing, that movie, Southpaw movie. He would come in every day exhausted, working sometimes 10, 12-hour days on his feet with physical activity, and the VaxD still got him out of pain and got him functioning, and he's doing quite well. So VaxD is a time-tested treatment, a very safe treatment, a very cost-effective treatment, a small fraction of the cost of surgery. We do ask that you bring in your insurance information. If you have any copay, co-insurance, any type of out-of-pocket expense, we will tell you before we do anything to you. The consultation is free. You come in, we give you all your insurance information, what your copay, co-insurance, any type of deductible will be before we do any type of treatment plan with you. Over 300 facilities worldwide now do VaxD. There's a few hospitals, medical, orthopedic surgeons doing VaxD in their office, chiropractic and physical therapy clinics worldwide now doing VaxD. This, of course, is VaxD, standing for vertebral axial decompression. So as I quite frequently ask, if you're out there listening, if you yourself or you know someone who's suffering with severe back pain or even neck pain, which we'll talk about the cervical options we offer here, unresponsive to your current treatment, you want to avoid further pain medication, epidurals, pain shots, therapy not working for you, surgery. You've been told you need surgery. You want a second opinion before you blindly undergo the knife. You know the risk of surgery are very good. I should say not. The risk of surgery are not great. I should say there's a very high risk of permanent complication with surgery. And if you've already had a surgery, second, third, or fourth, or more failed surgery, and you want to avoid another surgery, you definitely should give us a call and schedule a consultation. We'll tell you how to do that here in a few moments. If your symptoms are radiating into your hips, your buttocks, your groin, down your legs, numbness, tingling, weakness in your legs, foot drop. Again, we see this all the time. Just because you have a foot drop, just because you have severe neurological deficit does not mean you have to get surgery. You have so many people in the worst-case scenarios where they've had foot drops, disc extrusions, where the disc material is now herniated up into the spinal canal or down the canal, and they were told that surgery was their only option. Please, please, please get a second opinion first. We've helped many of those cases avoid surgery. They try to scare you in some cases to getting surgery, and again, you don't want to go down that route unless you have to. Again, I've gone to some of the best seminars. I've talked to some of the best surgeons, I should say, and gone to some of the seminars all over the country, and some of the best surgeons in the country have stood up there and stated, quote, lumbar discectomy surgery should be a last resort. Exhaust all your conservative treatment options first. So they're telling you that. So why would you do otherwise? Always use back surgery, especially fusion surgery, as a last resort, because it's a permanent procedure with possible permanent complications. And again, you don't want to go down that route because we see it every day, people coming in with these scar tissue, these permanent complications. We can help them in some cases, if not many of the cases, but now it complicates things. It creates more of a complicated case, requires more treatment in some cases, and the success rate is slightly less, even though we can help people. In some cases, we can get you 90% better, get you down to a pain level of maybe a 1 or 2, but you may still have a little bit because of the scar tissue, depending on how severe the complications are from surgery. But in most cases, we can get you much, much better than you were following the surgery and the pain and disability that you're suffering from. Again, the BackTalk procedure, again, we've been doing this for over 20 years now here at the American Back Centers, helping people with these difficult disc-related conditions. The only FDA-approved, safe, clinically proven, non-surgical, non-invasive disc treatment that truly has the research, again, supporting that it actually truly decompresses. And I talk about decompression. It's not a pump-up device. It's not an inversion table. It's not a traction device. A decompression is actually creating that negative pressure, forming that vacuum, pulling that disc material back into place, pulling the fluid and nutrients back into that compressed disc, opening up the space, but also pulling the disc material off the nerve out of the canal. Only BackTalk has been proven to do that. These conditions include discs that are herniated, degenerated, posterior facet syndrome. A lot of patients come in with what's called facet arthritis. Those are things due to compression on the spine again, causing those facet joints on the back part of the vertebrae of the bone of the spine to prematurely degenerate. Degenerative joint disease, arthritis, degenerative disc disease, sciatica, stenosis, numbness and tingling, and of course, as we mentioned, failed back surgery conditions. Unique BackTalk treatment table is protected by patents issued in the U.S. as well as internationally. Of course, this breakthrough technology was developed by Dr. Alan Dyer, who is the former Deputy Minister of Health of Canada, who pioneered the research on the heart defibrillator. Of course, a very important invention. Research to develop BackTalk treatment was conducted over a period of 6 years with the combined efforts of physicians, engineers, and technicians at major hospitals. So we are doctors dedicated to bringing you long-term relief. We talk about medical doctors, orthopedic surgeons, chiropractic physicians, physical therapists, all doing this procedure across the country at over 300 facilities. Approximately 3,000 patients a day are currently being treated with BackTalk, and avoiding the need for surgery now as well as into the future. Don't wait until your condition worsens. Call us today. We do have a toll-free number to schedule your free consultation. Our toll-free number is 1-888-222-8293. Again, 1-888, not 1-800, 1-888-222-8293. We are closed on Wednesday, so we do have an answering service. Of course, you can talk with them, give them your information. We will get back to you as soon as we can. Most likely it would be Thursday morning, and we get back to you and tell you if the time and date that you want for your appointment is available. We try to get you in, especially in emergency circumstances, because we do book up very, very quickly here, and we are booked out somewhat. But if you have an emergency circumstance, we can try to squeeze you in. We do have people that do change their consultation time, so occasionally we'll have availability same day or next day if someone does change. But if you do have a true emergency, we try to squeeze you in. We've been known to have many new patients in one day to squeeze them in to help them out. We will accommodate to help you out, especially if you're in an emergency severe pain situation. So again, toll-free 1-888-222-8293 or 724-935-3300, 724-935-3300. Also, our fax number, we do encourage you, if you have a MRI or X-ray or CT report, if you'd like to fax it over, or if you would like just to call the facility where you had it done and they can fax it over for you, just give them our fax number, 724-935-3321. That's 3321, 724-935-3321 is the fax number. Many patients are coming from many hours away. We do have a list of hotels, overnight lodging on our website, www.americanbackcenters.com. So if you'd like to fax over the report, you're coming from many hours away. In some cases, we can take a look and see if there's any obvious reason why you should not make the trip out here, especially if you're coming from a great distance. Some people like to have them faxed over so we can look at them prior to them coming in for the consultation. Of course, you can schedule, have it ready for when you come in by faxing it over as well. Again, 724-935-3321 is the fax number. Remember, you can just call the facility. Remember where you had it done. In some cases, just give them the fax number, and they'll do all the work for you. In some cases, you have to go in and sign a form, but many will allow you to do that, especially if you already have a form signed on file at the facility. All right, so we also have a website, www.americanbackcenters.com. That's with an S, American Back, B-A-C-K, Centers, with an S, plural, .com. Visit our website. You can actually request an appointment right on the website as well. You can request our newsletter subscription as well. We have a daily health update newsletter, which we send out every day with new health tips. We can sign you up for that by going to the website and signing up for that. You automatically get signed up for the monthly In Good Hands newsletter when you do that as well. It's a monthly, more lengthy health article done from some of the greatest minds in the health industry across the country. You can't believe some of the people that contribute to this monthly In Good Hands newsletter. They've been on Dr. Oz, The Doctor's Show, very well-known people. So you're getting great information with both the daily, but most importantly, I should say even more especially, you're getting it from the monthly because there's some great minds going in that. The daily health update is updated by us and our service, and we're doing nutritional tips and a quote for the day, inspirational quote for the day, so it's a great way to start off each and every day. But there's a lot of people that go into that monthly In Good Hands newsletter, so we do encourage you to get both. When you sign up for the daily, you're getting the health tips, the inspirational quote. Different health tips throughout the day are a great way to start off the day. If you don't have time to look at it, you can always skip it over and look at the new ones the next day. But once a month, you're getting a more detailed, lengthy newsletter free of charge when you sign up for the daily health update newsletter. So go ahead to the website and do that today, www.americanbackcenters.com. Also, you can visit our Facebook page, American Back Centers Pittsburgh. If you have a second, go on there and like us. Just takes a second to like it. Check out some of the articles. We try to touch on some of the articles we're going to be touching on this show. We have the low back pain and running athletes link up on the Facebook page, so you can go there and print that off if you need to, or you can go to dynamicchiropractic.com and look for the March issue, low back pain and running athletes. Or again, you can go to our Facebook page, American Back Centers Pittsburgh, like us, and then check out the articles, including the article we'll be touching on today. Again, American Back Centers Pittsburgh on Facebook. All right. So in addition, my email address, if you have any questions, is Dr. Pedduzi at AmericanBackCenters, that's plural again, .com. If you have any questions for me today, of course, we do have open phone lines, 412-825-6262. That's to call us here on BackTalk. Of course, if you have any questions, you can always call the office, 724-935-3300, or toll-free 1-888-222-8293. So a little bit more, of course, the VAXD is a medical procedure, the only FDA-approved, safe, clinically proven non-surgical disc treatment out there. We also offer cervical disc treatments. If you have a bulging disc, herniated disc, cervical radiculopathy, you have degeneration of your disc of your neck, you even had failed neck surgery, you're contemplating neck surgery, and you want to avoid another surgery, or you want to avoid the first surgery, give us a call. We have a great treatment that we've used for many, many years with great success for the disc problems in your neck region. We do therapy and rehab, state-of-the-art facilities, and individualized programs, ergonomic and postural instruction based on your individual needs, whether it's the neck, the back, the shoulder, knee, ankle, foot. We have structured programs for each individual person and body part. Wrist, hand, finger, foot, ankle, knee problems, examples including tendonitis, rotator cuff, carpal tunnel. We've helped people rehab after a prosthetic knee surgery, hip, prior to the surgery, helping them to avoid hip surgery, knee surgery as well, by doing the rehab right here at the office. If you have a script, say, from your PCP, you can bring it right here, and we can do it right here. In addition to the therapy, we have all the same therapy options that any therapy facility would have. In addition, we also do chiropractic work, massage therapy as well, and we have specialized treatments for disc conditions, as we mentioned, in the cervical and the low back region, that those therapy offices are not going to have, of course. Deep tissue massage, myofascial trigger point therapy, acupressure, reflexology, done right here at the American Back Centers by licensed massage therapists. Comprehensive nutritional consultations we offer as well through standard process. If you'd like to have a copy of one, you can call us. We can send it out to you. You can fill it out free of charge, and we'll send it back to you and score it for you. It's a great way to see, based on your symptoms, what you're experiencing through different body systems, what your nutritional needs may be. So it's not like we're just throwing a dart at a dartboard, per se. We're actually looking at what you're seeing symptom-wise, and based on that, we can give you a nutritional evaluation. So it's very comprehensive, and it's free. Custom-made orthotics, computerized digital scanning system. We have a new 3D scanning system that assesses the foot in a very accurate way. The patient simply just stands, so there's less error as opposed to standing into a casting kit. You can have doctor error as well as patient error with that if they don't push in exactly the way they should. As well as this is very simple and very accurate, and it assesses all three arches of the foot. And you get a nice computer color printout of any possible dysfunction. And, of course, again, not everyone has dysfunction, contrary to what you may think. Not everyone has. It's not a money-making scanner. It's a scanner showing if there's any possible dysfunction. And it's truly accurate, and people love it because the orthotics are truly custom to their individual problems. Acupressure treatment, we have great success, for example, with sinus issues. Each and every day I have people coming in, especially with this up and down of the weather. One day it's warm, one day it's cold, really playing havoc with people's sinuses. So we can work on that. We do simple acupressure treatments, which promotes drainage. And it's remarkable, within 2-3 minutes of the acupressure treatment, they're already starting to drain. Very easy, very safe. Diagnostic imaging, in-house X-ray, nerve conduction, ultrasound testing done right here at the American Back Centers, in a convenient MRI facility right across the street to our office. So if you need it, we can write you a prescription for an MRI CT, and you can literally go right across the street. Finally, I'm also a certified personal trainer. I can help you get back in the gym and do things correctly without injuring yourself, and I have that experience and that certification. So we talked about the VAXD, our success rate. We're one of the most experienced facilities. Our protocol is physician-directed. Our protocol engages other modalities as needed on a case-by-case basis. We have over 20 years of experience, one of the most experienced facilities in the country now, instituting this care. Our success rate with that is higher than the national average. VAXD nationwide is approximately 75% success rate. Our success rate here at the American Back Centers is over 92%, and it just makes sense. We've seen more patients. We've been doing this a long time, and we've perfected our protocols. And we do things a little bit different than other facilities as well. Our protocol is unique to our office. And, of course, we screen out and decline candidates whose medical records and evaluation indicate we're unlikely to help them. So if we don't accept you it's okay. We can send you off to someone else, but if we do accept you, you have a really good chance, because we've seen a lot of patients here, and we're not going to accept you as a candidate for this procedure. We don't think we're going to help you. Over 92% success rate in our office, and we're not inflating it to 98 or 99, or some of these offices that say 98%. I don't know how you could even make that claim. And we even see that with the laser disc surgeons, 98% successful. Does that mean that they had success for a month, they felt a little bit better for a week? And we see that commonly with surgery. They claim success. The patient may have some relief for a week or a month, but then the pain comes back. How is that truly successful? 92% success is that the patient is pain-free and stays pain-free 4+ years, if not permanently, following the procedure. And part of that is we follow it up with good rehab in our office, making sure the patient is keeping that core strong throughout the middle and end of the treatment program, as well as after they discontinue with treatment. They're keeping up with that core strengthening, keeping that core strong, and helping to prevent this condition from reoccurring. The VAC-C table and its computer, as we mentioned, work with each individual patient, adjusting back tension, with in turn adjust interdiscal pressure moment by moment. The computer adjusts the tension in small amounts so that the muscles in low back do not spasm or contract during treatment, which allows decompression to take place. So it doesn't allow, simply when you're just stretching with these traction inversion tables, you're not creating negative pressure, you're just stretching. There's a natural reflex muscle spasm that prevents negative pressure from occurring. The engineers and doctors that went into the development of this computerized treatment, VAC-C, were able to overcome this, and that's why negative pressure is produced, upwards of a negative 160 to a negative 200 millimeters of mercury, creating that true vacuum effect. So we do offer a free consultation at no cost or obligation. If you'd like to come in and talk with us, we do encourage you to bring somebody in with you if you can when you come in for your consultation. Number one, it helps you if you're in pain, so you don't have to drive out here yourself. We encourage you to bring in your MRI, CTs, X-rays if you can. Again, it's a free consultation. We're going to answer all your questions. We're going to spend time with you, going over your problem in detail, detailed history, physical exam, neurological exam, to determine if you are a candidate for the procedure. If you are a candidate, you have a remarkably high success rate with this procedure. We also offer the free DVD. This is when Channel 11 WPXI did a medical breakthroughs report on our office. We touch on this all the time on the show. If you'd like a copy of that DVD, call our office. Our office was interviewed by Channel 11. This was broadcasted on Channel 11 News. They showed all the success we had even back then, helping people avoid these back surgery procedures, as well as neck surgery with the neck procedure as well. We also have that 24-page Keller booklet describing VAC-C, all the research, all the ins and outs of VAC-C. You can call for as well. Just call our office, and we can send you out the 24-page Keller booklet, as well as a DVD when Channel 11 did the medical breakthroughs report on our office. We have the research papers that we typically send out. The first paper is published in the Canadian Journal of Clinical Medicine. This research is done right here. We're very proud of this. Done right here at the American Back Centers and published in a medical journal. The Knife in the Back article we touch on all the time, showing the failures of back surgery, specifically fusion surgery, and why it's a money-making procedure for hospitals and medical clinics, but it's not very successful, and it's a very high rate of complication, permanent complication. We also have the blue workers' comp book and the yellow auto accident booklets. Again, we send those out all the time, free of charge. So many people love these books, because I just had somebody the other day just talk to me about the blue book, and I remind them all the time to read the blue book, because when you're hurt at work in a workers' comp case, a lot of times you don't know these answers to these questions. These questions can be very, very difficult as well, as far as patients having difficulty and pain. And again, with these workers' comp situations, many times they're taken advantage of by the insurance company and or the employers. The employers, again, in many cases want them back to work as soon as possible. So many people don't know their rights, and they're taken advantage of. So you have to be very, very careful with that. So get this booklet for someone you know. If you yourself were hurt at work, definitely we can send this out to you as well. If you're hurt in an auto accident, whiplash case, get the yellow booklet as well. They are both a free service. They're both done by an attorney, so they have all the up-to-date legal information in there as well. And don't get taken advantage of by workers' comp or auto cases. So again, get these booklets for your friend, yourself. They are free. just call our office, 724-935-3300. We can get those for you today. So we talk about National Institutes of Health, 9 out of 10 back surgeries not successful. British Medical Journal, American Medical Association state lumbar disc surgery is not successful. We've seen this over and over and over, where these procedures have a high rate of complication. They're permanent procedures with possible permanent complications. So again, that's why we're out there doing this radio show. Hopefully you out there will tell your friends, your friends, your neighbors, your relatives, anyone you know that's contemplating back surgery. They've already had back surgery. They have stenosis, sciatica, disc problems, degenerative disc disease, foot drop, weakness in their legs, to at least come and talk with us and see first, before they blindly undergo the knife, if this procedure may help them, or if they're a candidate for the procedure as well. Again, we can tell you that by coming in, and it's a free consultation. Again, if you've listened to our TV or radio advertisements, our motto is, it's been for many, many years, you have nothing to lose but the pain. You really don't. You have nothing to lose. It's a free consultation, coming in and talking with us. And again, if we can help you, you'll be very happy, because now you can avoid these possible complications possible complications that you may very well undergo with these surgical procedures. And all the lack of success that you have with what I call the gauntlet, pain medication, epidurals, pain injections, all these things that can occur over time, these things can get much, much worse. So again, when we talk about the VAC-C procedure, we talk about laser spinal surgery, minimally invasive spinal procedures. These are all things that are something that we cannot help with. Again, laser spine surgery is something we talk about on this show all the time. It's misleading language used in promotional material from other centers, when in fact what they do is very traumatic access operation requiring a sizable opening, stretching and tearing of muscle, drilling and cutting out of bone, ligament, and commonly joint as well. So we talk about with laser spinal surgery, they talk about it's safer, it's more effective, but it's not. In many cases, the incision is bigger. They have to rip out ligament, bone, and tissue before the laser even goes in, and that's definitely a problem. So ripping out ligament, bone, and tissue is not something that you would want. And when the laser surgeon actually talks about how when you're ripping out ligament, bone, and tissue, you're actually making the problem worse because you're causing permanent damage. So what therapeutic benefit does the laser actually have at that point when you've already caused that damage? And it's so, again, just snipping off the bone, I should say the disc, just like a discectomy surgery, just snipping off a piece of the disc. And that's, again, not addressing the compression on the spine. So, again, laser spinal surgery, this is coming from a surgical site, talking about and comparing the hype debunked with surgery. Minimally invasive spinal surgery, again, is something that we talk about on this show many times as well. It's not really invasive. It's a spinal surgery. They're still snipping off a piece of the disc. Microdiscectomy, we talk about snipping off a piece of disc as well. Again, not really addressing the actual compression on the spine. The bone spurs are still occurring, and it's something that should be avoided at all costs. So also, take a look here as well. We also talk on the hype debunk section here as well. We talk about microdiscectomy. We talked about also the artificial disc replacement, also they address here as well. That's something that was done many, many years ago in Europe, and really has not come here to the United States because it's not been very, very successful. That procedure, of course, was not really adopted here in the U.S. because just like a prosthetic limb in many cases, the body did not really accept the artificial disc replacement, and it was not very successful. And they would have problems very similar to the fusion surgery, where the areas above and below, and there would be problems. So that's why you don't see much of that as well. So again, we're here helping patients avoid back surgery because we see the standard procedures, the discectomy, laminectomy, the fusion surgery are not successful. A high rate of complication as well with these procedures, and we want to help you to avoid this. All right, before we get into the nutritional segments today, we're going to highlight some key nutritional items that we have in our office. We talk about the esterified fatty acid complex, and we talk about glucosamine. And we have a great liquid glucosamine product called liquid glucosamine that has the 5 key ingredients: collagen, glucosamine, chondroitin sulfate, MSM, as well as collagen, all in one liquid formula. And it works very well because it's in liquid form. It's highly absorbed. The absorption of this product is great, as opposed to taking a pill or a tablet. And patients see great success with it with their joint issues. But some patients do not respond well to glucosamine, chondroitin sulfate, as well as MSM and collagen, hyaluronic acid. And this product has all 5 of those together. So there is an alternative. And it just came out not too long ago. Hope Science has a nice product called esterified fatty acid complex. And they've done some research showing marketing of joint products has resulted in a lot of confusion, a lot of wasted money. So they go on to say, let's clear up by comparing esterified fatty acid complex research to glucosamine research. EFAC is supported by research published in top medical journals. Glucosamine has shown minimal or no benefit when compared to placebo in well-controlled clinical studies, trials. Now, this is what they're stating, and they're trying to sell their product, but they are seeing good results, especially with, and we're seeing good results at our office, just with people that have tried glucosamine, hyaluronic acid, those type of products, and have not done well. They've tried this, and they have done well with it. So some people do well with one product, some people do with another product. So if you've tried glucosamine, hyaluronic acid, and if you want to try something different, something new, they have a nice topical cream that absorbs very well as EFAC capsules, restoring joint health and improving flexibility and pain, and repairing some of that damaged cartilage as we get older in the hips, the knees, any joint in the body. The esterified fatty acid complex may be right for you. Again, it comes in the capsule form or the topical cream. So we can definitely help you out with that. Just call our office. We can send it to you for a small shipping fee. We can pick it up and save the shipping fee. Again, it comes in a topical cream or a capsule form. We also have the Intramax, the all-in-one liquid multivitamin. I talk about this as being the best multivitamin on the market. We love this. I take it myself. There's the Intra-Kid for the kids as well under the age of 18. 415 different ingredients in one product. It's a liquid product. You're taking 1 ounce a day. You're literally taking a shot a day. Highly absorbed. There's great placebo, peer-reviewed double-blind placebo studies showing the effectiveness, the absorption through this, quote, intracell technology. It's a proprietary carbon bonding process called intracell technology. Maximizes detoxification in order to infuse the nutrients of this product deeply and rapidly into the cell, converting the inorganic matter to 100% carbon-bound organic molecules. The result is complete liquid nutrition all in one source. So Intramax, truly highly absorbed, a great, great product. I take it myself, the Intra-Kid as well. And for the kids under the age of 18, great products, and in my opinion, the best multivitamins on the market. If you'd like to try them, we offer a $5 discount or free shipping for trying your first bottle of Intramax or Intra-Kid. Finally, we have the LipoLite procedure, which we touch on each and every week here. A great way to slim shape and tone. Very safe way if you want to lose a dress size or a shirt size. LipoLite triggers lipolysis in fat cells, which causes fatty acids to be broken down and released. LipoLite stimulates fibroblasts, strengthening the collagen and elastin fibers to tone and tighten the skin. It's an easy way to slim shape and tone. We've seen great results with our women as well as our male patients that want to lose a little bit around their stomach, their love handles, even the back of their arms or triceps where they have a little jiggle there per se. It helps to tighten and tone, and again strengthens those fibroblasts, strengthening the collagen and elastin fibers to tighten and tone the skin, but also liquefies the fat cells, which cause the fatty acids to be broken down and then released through the process of LipoLite. So very safe procedure. If you'd like to try LipoLite, if you want to get ready for your swimsuit, as it's rapidly approaching here as the weather hopefully will continue to improve as we get into spring and summer, you may want to try LipoLite. Just call our office. We can schedule a consultation and go over that with you if you're a candidate for the LipoLite procedure. And finally, the real question should be, why would you even think about surgery with all its complications and lack of success, not including the normal risks, including infection, bleeding, or blood clots that can occur in death in many cases with these surgical procedures? Blood clots. See, we talk about Dwight White, the Pittsburgh Steeler. He had 5 back surgeries. On his 5th back surgery, he had a blood clot, which eventually killed him. Not a common complication of back surgery, but it can happen. We talk about the simple lack of success with back surgery. Vaxxed is an option. Of course, Vaxxed is a non-invasive, very safe treatment with a much, much higher success rate than surgery, pain injections, or physical therapy. Many patients go this route and eventually end up at our office wishing they would have come to us much sooner. Remember, Vaxxed addresses the structural issues, not just the symptoms. Truly decompressing the disc, restoring the fluid content, taking the compression off the spine of the disc, relieving your pain associated with low back pain, disc problems, herniated or degenerated, extruded, foot drop, sciatica, stenosis, failed back surgery and numbness, and tingling. Before I get into the low back pain and running athlete segment today, just want to remind you, we're also offering a new product. We have not got it into our office yet. We just ordered it yesterday. We've talked on this show about hemp oil and the CPG component of hemp and how it has many possible health benefits. There's a topical cream with a very high concentration of CBG, level 3 through level 5. Level 5 would have the highest concentration. It costs a little bit more as well. Topical cream, great for chronic pain. I've talked to a lot of people, and they've seen dramatic results with it, even much better than with the hemp oil. We're also getting the sublingual hemp oil that comes in a dropper that you put underneath your tongue. A higher dose, possibly we're seeing research, may be effective with autistic cases as well as schizophrenia. We talked about that on the show a couple weeks ago, as well as other chronic cases as well. So we're very anxious to try that out on some of our patients and patients' relatives and or kids that may be suffering for those type of diagnoses to see if it's helpful, because the research is definitely supporting that. So we're going to be offering the CBG hemp oil cream for pain relief, chronic pain relief, as well as the hemp oil, sublingual hemp oil in the dropper. Very soon we should be getting it here any day here at our office. We'll touch more on that in later episodes of BackTalk about the hemp oil and some of the new research supporting the effectiveness of this new product called hemp oil. All right, so we're going to get into the low back pain and running athletes. This is from Dynamic Chiropractic. Again, if you'd like a copy of this article, go to our Facebook page, American Back Centers Pittsburgh. You can print it off from there. You can go to dynamicchiropractic.com, look for low back pain and running athletes. So this is from a doctor, M-A-C-H-U-D, and he goes on to say, Dr. Thomas, and he goes on to say, after 7 million years of adapting to upright postures, the lumbar spine and the pelvis has become remarkably adept at managing ground reactive forces associated with running. In fact, the discs are so strong when standing upright that it's almost impossible to herniate a disc while walking or even running. But we do see a very high incidence here at our office with chronic, but marathon runners and long-distance runners, because they're constantly 3 to 4 times their body weight hitting into the spine. So I tell patients that come in here with disc problems not to run or jog, just use the elliptical machine, walk on a flat high school track, flat surface, or walk in a swimming pool because you're avoiding further compression on your spine, sometimes 3 to 4 times your body weight when you're running or jogging into a already damaged, compressed disc space. Goes on to say, even the sudden application of extreme vertical forces will cause the vertebral end plates to fracture before the intervertebral disc herniate. Nevertheless, gait cycle-related low back injuries do occur, and they can usually be related to a variety of biomechanical problems, ranging from muscle imbalances to leg length discrepancies. So when we talk about biceps femoris tightness, which is very common due to increased tension in the sacrotuberous ligament, effectively blocking the range of sacral nutation. So your sacrum, your tailbone, nutation forward, necessary for shock absorption. Very common in running athletes. Treatment in this situation involves identifying the various factors responsible for maintaining biceps femoris muscle tension, taking corrective action. The biceps femoris is in the back of the upper leg. Tightness may result from joint dysfunction in the lower lumbar spine and or the quad, quad/hamstring muscle imbalances. So you want to look at all that. You want to look at the quad, the hamstring. So we do that. We do different muscle techniques for the hamstring if it's tight, quad, strengthening if it's weak, creating that muscle or decreating that muscle imbalance. So you're taking that tightness of that bicep femoris and that sacrotuberous ligament, necessary again for the nutation of that tailbone forward, necessary for proper shock absorption while you're running. Weakness of the hip abductor muscles is perhaps the most common cause of low back pain in runners because the gluteus medius and minimus, your butt muscles per se, function to keep the pelvis in a nearly horizontal position during stance phase. Weakness of these muscles, which is common in runners, will cause the pelvis to tilt in the frontal plane, allowing the lumbar spine to laterally flex excessively. Chiropractic adjustments are often necessary to restore motion to damaged joints, and specific stretches, exercises can be prescribed to lengthen and stretch the hamstrings piriformis, multifidi, and erecti spinae, which, of course, we do here right at our office. The exaggerated lumbar lateral flexion may result in chronic injury to the lower lumbar spine, especially if your core muscles are weak. So that's one of the things we do here at our office. We concentrate. We have 3 different levels of core strengthening. This core weakness is very problematic when the hip flexors are excessively tight because the lumbar spine is allowed to hyperextend backwards during push-off. So some of the treatments we touched on, but effective treatment requires strengthening of the core as well as improving flexibility in the hip flexors. This can be accomplished with exercises, which we do at our office, that target the hip extensor and abductor muscles. These exercises are particularly effective when performed on unstable surfaces, so I would start them first on a stable table or floor, and then we can go to a balance pad, a ball. And to enhance neuro drive, the exercises can be performed by holding each position for up to 60 seconds. In addition, it's often necessary to perform gait retraining, in which the athlete runs on a treadmill in front of a mirror and looks to minimize the frontal plane motion of that pelvis. So the article does show some of the exercises that we do at our office. We do much more than this, but this is some of the examples, some of the exercises that you may do, specifically for the hip abductors. So that's on the article. If you have a copy of the article, you can look at that or, again, print it off so you can see that. So some of the other treatments include structural leg length discrepancies can be effectively treated with the appropriate size heel lift if it's an anatomical issue. Studies by Gauss and Taylor, subjects treated with shoe lifts reported significant reductions in pain and lost days from work, along with increases in overall ranges of motion when evaluated at a 4-month follow-up. The majority of literature supports a connection between low back pain and structural leg length discrepancies, although functional leg length discrepancies can occur. So these functional leg length discrepancies, of course, we can adjust the spine. We can also look at some of the muscles, which we touched on, can occur when hypertonicity in the pelvic muscles produce a pelvic torsion when measured in an unloaded condition. This type of limb length discrepancy can be readily treated with myofascial release, muscle techniques, which we do at our office, home stretches, quadratus lumborum stretches, which we do here at our office, helpful in managing functional leg length discrepancies as well as chiropractic adjustments. In contrast, a common misconception among chiropractors, physical therapists, and massage therapists is that the ilium can subluxate on the sacrum or the tailbone and lock in that position to produce a functional leg length discrepancy capable of producing chronic low back pain. Despite the widespread belief that the SI joint can subluxate, there's little evidence to support that. In fact, the notion that the ilium and the sacrum can subluxate and can reposition with manipulation was refuted in a study by Tolberg. So they talk about this. While manipulation has been proven to be effective for the management of acute low back pain, another study demonstrates that long-term chronic low back pain sufferers respond best to maintenance manipulations performed bi-monthly for up to 9 months. The author suggests that occasional manipulations may allow for the early treatment of the emerging problem, thus preventing future episodes of low back pain. So getting adjusted, looking at the rehabs, even looking at the rehab of the area, muscle weakness, muscle stretching, is very important. We do all that. And core strengthening, looking at strengthening those abductor muscles, as well as stretching that QL, piriformis, hamstring, biceps femoris, so it's taking the pressure off that sacrotuberous ligament, are all very common things we look at in runners that come in our office, as well as even looking at those heel lifts in some anatomical leg length cases, orthotics, which we touched on. We have that great digital scanner here at our office that scans the runners or the normal people that come into our office with normal, non-athletic, non-runner cases that may be having foot problems where they have bunions, heel spurs, they have plantar fasciitis, they have problems in their arches, their knees, their hips. Remember, it correlates all the way up into that kinetic chain. So you can have problems stemming in the foot that are causing problems all the way up in your neck as well. So it's a simple, free scan that we do, very high-tech scanning for these custom-made orthotics. So again, if you'd like to try that, call our office so we can see if you're a candidate for the orthotics by, again, 724-935-3300. Also, that finishes off the article. If you'd like a copy of the article, Low Back Pain in Running Athletes, go to www.dynamicchiropractic.com, look for low back pain in running athletes. You can also go to our Facebook page again, American Back Centers Pittsburgh. Take a second and like us on the Facebook page, and you can also download and print off the Low Back Pain in Running Athletes article. We do see a lot of runners here at the office, and we can help them, and we can see one of the ways that we do that through our structured rehab programs, combining chiropractic, physical therapy, as well as massage, as well as other muscle techniques together to get the patient out of pain and create a permanent correction. All right, we are short on time, so I'm going to leave you with some final closing thoughts as I do each and every week. Of course, again, ask for the research. Remember, do your homework before pursuing any treatment option. Ask for the research. Go on the Internet. There's many people out there. We see this with the disc treatment industry trying to scam you, lacking the research supporting that they actually do what VaxD does, even though they claim to be similar to VaxD. VaxD has a proven track record. It's used all over the world in over 300 facilities. 3,000 patients a day are currently being treated with VaxD therapy, and it's accepted by all fields of healthcare. Medical doctors, orthopedic surgeons, hospitals, chiropractic physicians, physical therapists all use VaxD in their office. And most importantly, it's something that actually works. It's been around for 20 years. It'll be around for another 20 years because with VaxD, the results speak for themselves. It's backed by real science with real results. I want to thank you for listening today. We'll be on next Wednesday and every Wednesday with another episode of Back Talk. This is Dr. Peter Pedduzi. Have a good week. Bye-bye.
You've been listening to Back Talk with Dr. Peter Pedduzi, sponsored by American Back Center, 103 Bradford Road, Building 2, Suite 100 in Wexford. For more information or to contact Dr. Pedduzi for an appointment, call 724-935-3300 or toll free 888-222-8293. That's 888-222-8293. And join us again for Back Talk with Dr. Peter Pedduzi.
At American Back Centers, you've got nothing to lose but the pain.